Ayurveda. We're going to talk about how you can take care of yourself better. That is all we care about. And we're going to give you different tools and education about that.
Hi everyone. This is the only place I think it's very easy for me to not talk about health. Because it has been with health day in, day out. So let me introduce Miss Nasia. She is our nutritionist and food coach.
Before we go in detail about Rayya Wellness, I wanted to ask everybody, did you have lunch today? Yes. So, is it like a croissant or chicken? What did you have for lunch today? What is the snack? Jollibee? Good one. Okay. So there's a beautiful vending machine there which offers a lot of coffee, cappuccino, but I can see there's brown sugar as well. So what happens is these days people tend to think that healthy food is very difficult to prepare. Am I correct? Correct me if I'm wrong, right? And also because this is a hospital, I understand it's very difficult, your duty schedule, preparing food is not that easy, and sometimes you have mid shift, so you tend to come early, right? But what happens when you don't eat on time? Let's say you skip breakfast, doc, or you skip lunch, what will happen? Like, are you hungry now?
No.
No, okay. So your energy level will go down, exactly. And what else? Will you be able to concentrate on your work? No. The next thing what I understood from a lot of people is that when they feel hungry, they tend to think about junk food. Okay, if you're a sweet lover, you tend to think about a lot of sweets. Let's say you're hungry and the quickest thing what you can grab is, in this scenario, in this hospital, if you're hungry, for example, what you can grab now, right now? Coffee with croissant, biscuits. If there is a vending machine, you tend to grab that. But is it healthy? Does it give you enough nutrients for the end of the day? No, right? So, and also, like for example, if you're thinking that you want to cook healthy food, let's say today you have bought chicken and salads, okay? You assorted everything, you prepared a dressing and you kept it ready, you took it for the next day to your lunch box. Will you be able to take the same item for the next day? What will happen? You tend to get bored, right? And there is a myth or a misconception in the society that healthy food is not delicious. Let's take a scenario. When you go to a mall or a restaurant, there are two setups. There is a healthy cafe, there is a KFC, or you name it, anything. Where would you like to go? There is a huge queue in KFC, there is a very little queue in the healthy cafe, okay? Where would you like to go? Be honest. I have seen from my own eyes that people are, standing in queue. They have enough patience to stand in a queue just for that fried food. I understand fried food is always tasty because it is dipped in oil, right? Any food is fried and dipped in oil is very tasty. But can we make healthy food tasty? Yes, we can make. But do you have enough time to make healthy food? No. That's where people like us come in. To make your life easy, to make, like, I understand that, like for example, you didn't eat for the entire day, but you don't know what to eat. So what we do is, we take that personalized meal plan. I cannot give you a food which you don't like. You have a lot of intolerances, you have a lot of allergies, you have your own dietary requirements and needs. The calorific requirement for you may not be for her, it's the same. No. That's why we personalize meal plan for people, right? So they say that you have to eat small and frequent meals. That's very important. Breakfast, how many people have skipped breakfast? A lot of people. Because why? We are in a hustle that, it's very busy these days. You tend to skip breakfast, but what happens? Ultimately, you'll grab lunch, which is very heavy, right? For dinner, you'll eat more heavier food. That tend to give you weight gain, obesity, diabetes. When diabetes comes in, and if you don't control it, if your insulin resistance, insulin level is up and down, what will happen? You'll tend to get blood pressure. Of course, there is stress levels, work pressure, personal life. So if your diabetes and blood pressure, if both is not in control, what happens? Cardiac problems, right? In a lot of cases. If you see the survey in UAE, because lot of people, they have this sedentary lifestyle. Anybody can go to the gym in the evening? Very rarely. But the amount of food what you eat is more than required by your body. That's where meal plans plays a very important role. Now, Rayya Nutri, it's actually, you must be thinking, what is it? Actually, we are a first 5-star wellness hotel, which is in the Palm region. So, we give you not only staycation, but also wellness and nutrition, both plays a role. For example, let's say if you come to our hotel, you will tend to find restaurant, but healthy meals. You will have quinoa omelette, you will have your favorite food, but we'll ensure that everything is in proper proportion. So this is how we come in. So we also ensure that, like, even if you go to the supermarket, you cannot buy locally available ingredients. One day you buy it, you keep it in the refrigerator. Next day you don't feel like cooking. Let me order, because why? Everything is on the tip of your finger. Right? You order something from Talabad or whatever delivery company, it comes, right? What happens? Within 15 minutes, you get your food. That's how it is. What happens to the food what you kept in the refrigerator? Is it healthy? No. Any food what you consume, you have to consume it fresh, not to keep it for the next day. Overheating, it will lose all your nutrients. So what can you do in this matter? Healthy food, people think that it is very expensive or it is very difficult to make. It's not, ideally. So what I would suggest is try to follow a healthy lifestyle is very important, because you all know what kind of patients are coming in the hospital. Majority will be diabetes. Yeah, majority patients will be diabetes or obesity, hypertensive, cardiac patients. Mostly if you see, it will be a cardiac patient. So I would suggest you all to take a lifestyle. So can you skip a coffee? If you're a coffee lover, can you skip a coffee? What you can do? Coffee is good for your body? In general, it's not. So taking anything, even sugar, you can take sugar, but everything should be in moderation. You cannot, you don't understand why when you take 2 tablespoons of sugar, but how much amount of coffee you consume in a day, then that's a concern. So that's why you need to eat fiber-rich food, vitamin-rich food, proteins are required in your body so that you will feel fuller and you will not tend to skip your meals, you will feel fresh, you will feel energetic, and you can maintain a sustainable life for a longer period of time. And to avoid all kind of diseases, you need to maintain a lifestyle, and it's very important. Because these days people get cholesterol at the age of 26. People come to me and tell me that they have cholesterol problem at the age of 26, 27, and they know why they got it, because they have a sedentary lifestyle, they don't eat on time, they tend to eat lot of time from outside. These foods tend to give you, like, give you this craving, but ultimately your health matters, right? At the end of the day, you will spoil your health. So that's why healthy eating habits are very important. So are you drinking water enough? This is summer now. How many people have a habit of drinking water with chia seeds? Anybody? Oh wow, great. So let me just check what will happen if you drink water with chia seeds on a regular day, and if you don't drink water with chia seeds. Do you tend to crave for sugar whenever you drink chia seed water? Yeah, exactly. So chia is rich in fiber. This is just an example. If you drink chia seeds with water, what it will keep you feel fuller for a long time, and it will crib your sugar hunger. Try to do this, and this will keep you hydrated for the entire day. So try drinking water with chia seeds. It's very beneficial. It has omega-3 fatty acids. It's good for your body, good for your skin, and it keeps you hydrated. So as Rayya Nutri, as I was explaining, what we do is, we know each individual have different dietary eating habits, different dietary needs. Your likes and dislikes may be different. Maybe somebody is having an Arabic dish menu, but somebody is having an Asian menu. But I cannot ask you to eat an Asian food. I cannot ask her to eat an Arabic food. That's why what we do is we do curated personalized meal plan. I actually invite all of you to come and visit our hotel. We also have our one-on-one consultation. So we have our BMI machine. We talk to our clients. We curate their menu, personalized meal plan for them. Okay, there is one particular day which you can consume as a cheat day, but you should be mindful or watchful on what you're eating. That's very important. Portion size is very important. You go to a buffet, oh, okay, it's my cheat day today, then you tend to eat everything sugar. That's not a good sign. But yes, eating sugar food in limitation or moderation, that's fine. So this is called as our protein bars. This is actually assorted bars. This is granola bar and this is pistachio protein. So these are consumed by people as a snack. Okay, what it keeps is it is rich in protein, it is rich in fiber. Yeah, so this is made from pure maple syrup, no additives, no preservatives. Yes, they make it fresh daily. So what it will do is it will keep you fuller. So you tend to not crave for anything sweet. This will cover your day, plus it will keep you fuller for a long time because it has fiber.
Before that, can I ask you something? How many of you know about something known as Ayurveda? Yes. Oh. Yes. Wow, most of you people know. So Ayurveda, so for the people who don't know, let me explain. Ayurveda is a ancient system which is practiced in India mostly, but now it is getting a worldwide popularity. Okay, it is a age-old therapy which is being practiced starting from 5,000 years ago. Now with the help of so many research, so many reference, everything, it is coming forward. Okay, so let me split this word, Ayurveda. So Ayur, according to a language called Sanskrit, which is a language in India. So according to the language called Sanskrit, Ayur means life and Veda means knowledge. So the whole word meaning is either science of life or knowledge about life. Okay, so this concept mainly works like it is totally different from, like, I know this is a hospital background, but still this is totally different from the allopathy medicines. The principle what we are believing, that is what Ayurveda is believing, is depending upon Pancha Mahabhutas or 5 element theory. You know which are the 5 elements?
Earth.
Earth, yeah, you can say earth, fire, water, space, Agni or fire. Okay, the 5 elements or Pancha Mahabhutas. So Ayurveda mainly work upon this 5 element theory. So these 5 elements combine to form something known as Tridoshas. So if I go beyond all these Sanskrit words, it will be really difficult for you people to understand, but still why I am saying is because when a person comes for a Ayurveda consultation, so when any patient or a guest or somebody is coming for a Ayurveda consultation, the doctor will be asking, or the Ayurvedic practitioner will be asking a series of questions. Okay, so we are also having some diagnostic method which is totally different from the modern diagnosis. We'll be having the diagnostic methods like Nadi Parireksha, the pulse diagnosis. So in the allopathy medicine, we are having the pulse diagnosis where we'll be identifying the what is the like normal value of the pulse, how much is the pulse, what is the rhythm, what is the rhyme of the pulse, all those things will be identified. But in the case of Ayurvedic diagnosis, the Nadi Parireksha, they will be identifying the rhythm of the pulse. So according to this is one of the diagnostic method. Other than that, there is something known as tongue diagnosis. There is iris diagnosis. So using these series of techniques, the doctor will be diagnosing the disease. So before diagnosing the disease, the doctor will be identifying what type of body constitution is yours. See, all our body constitution is different. I am different from you, you are different from her, like each one of our body constitution is different, right? So using series of questions, the doctor will be identifying what type of body constitution is yours. So this body constitution is defined with the help of something known as Tridoshas, that is 3 doshas, that is Vata, Pitta and Kapha, which is a combination of the 5 elements. So when there is an imbalance in these 3 doshas, according to Ayurveda I am speaking, according to Ayurveda, if there is an imbalance in any of these dosha, it is resulting in a disease condition. So when these three doshas are in a balance, the person is having a healthy or harmonic life. So when there is an imbalance, it is leading to some disease condition. So that is a key concept or key principle which has been practiced in Ayurveda. So I told about what is Ayurveda, what is the principle behind Ayurveda, and what is the diagnostic method that we are using in Ayurveda. The next thing about Ayurveda is the treatments. So we are having a series of treatments like both internal medications as well as external medication. So the internal medications which we are giving will be more herbal or decoctions or a combination of some like the plants, herbs, all those compressed, all those things will be giving, as well as some oils which can be applied externally, some decoctions that can be taken inside. All these are some of the medicines which we are giving. Other than that, we are giving so much of treatments. That is I don't know, anybody have experienced Ayurvedic therapies? Yeah, so we are having a massage also. So the massage which we are practicing is, so we are having some like either it will be like dry massage or something with the help of oil massage. Okay, so so the name which we call in our side will be from Ayurveda, it will be Abhyangam. So that massage will be like using some oil, they will be applying it. And the main thing is like for Ayurveda therapies to be performed, we are having the therapists who have studied the Ayurveda therapy course separately from this Ayurveda, like whatever the 5.5 degree course the doctor will be studying, and this Ayurveda therapist will be studying the therapy course. So they will be also getting an exact knowledge about the anatomical, physiological aspect of our body. So by knowing all these things only, they also will be performing the particular therapies. So in that therapies, one of the things is like we are having this Abhyangam, like full body massage. We are having something known as Kiri, that is the bundle treatment. So we'll be making a bundle, we'll be putting the herbal powder or the medicated powder and we'll be tying it and making a bundle like thing. And that bundle will be dipped in the warm oil, and then it will be like for the particular areas or what mainly for the joints and all, we'll be doing the massage using that bundle. So the main concept behind this is also like this powder will be able to absorb the water accumulation. Like if there is a joint pain, there is like a chance of inflammation. So that accumulation of the water will be done by this bundle massage. So that is one of the principle behind this bundle treatment. Another treatment which we are performing is something known as Shirodhara. I think most of them will be like familiar with the picture, like a lady will be lying down and the oil will be directly dripping over the forehead. So like it's the most common picture which you will be able to see everywhere regarding the Ayurveda. So the oil will be direct. So which I don't have to ask, like which gland is situated over here? Pineal gland. So our pineal gland is situated over here. So if like we know that the pineal gland is one of the gland which is mostly in relation with this balance of our emotions, like related to concentration, for maintaining the insomnia, all those things it helps, like to cope up with the sleep disorders. So the main theory or the main principle behind this Shirodhara is when the warm oil is directly dripping over the forehead, it will help in stimulation of the pineal gland, which will in turn help to cope up with the stress, anxiety disorder. So like there is a series of taking of this, like we have a course period, and it won't be same for every person. As I told you before, according to the body constitution, the treatment may vary, the course may vary, as well as like which oil is being used in the particular treatment also may vary. So these are like I just explained like very few treatments about the Ayurveda. Apart from this, Ayurveda is a therapy which you can practice or which you can take to your life, to your home, which you can practice in your home by practicing some lifestyle changes. So we all are having a hectic life. We all are coming, getting up ready, we are just shooting up, we are just want to reach our workplace. We'll be having, as I like Miss Nazia told, she explained about the healthy way of eating a lot. So same like that, Ayurveda is also recommending a diet as well as a lifestyle modifications which you can take part. So you will be having a home remedy which you can you will be having the, according to Ayurveda, we are not able to follow everything what is coming under Ayurveda, because we have to get up in the early morning, that is around 3:30. All those things has been told in the books, which has been written in the books, but we are not able to practice. But few things which we are able to practice is like a healthy way of lifestyle. What we eat, what we do, what we think, what we perform. So that is one of the core thing which helps to make ourselves healthy. Not just the external beauty or just the internal organs, all those things, but our mind also. The mind body is one of the most important thing that is required to have a healthy lifestyle. So this is like a whole story about Ayurveda. So Ayurveda is one of the most traditional therapy which has been practiced in India 5,000 years ago. You all can experience Ayurveda from anywhere, but make sure when you experience Ayurveda, you are doing it with full-heartedly. That you are going and experiencing a Ayurveda session or Ayurveda therapy. What happens is most of the people will be experiencing the Ayurveda after giving up with almost every therapies. No, now I will experience this also, whether I'll see whether I can change my my particular disease or something, whether it will get changed. So I'll just go and experience that also. But if we do like that, that won't be giving a much result. With our heart, as I told, our mind also plays a very important role in coping up with this thing. The lifestyle changes which you can do is, one of the main lifestyle changes is a healthy way of food, as I told. Another thing is practice of yoga, pranayama, exercise. You know about pranayama? Yoga, okay, yoga you know. So in yoga, what and all things you know? Shavasana? Wow, nice answer. Meditation, okay. According to yoga, it is like a, what I can say, it's like a sea. Actually, what we are saying, the Shavasana or whatever asanas which is coming, it's like just a part in yoga. Yoga, the part of yoga is just asana. Asana is just a part of yoga. Other than asana, another thing which is coming is pranayama. Pranayama is nothing but the breathing techniques or breath exercise we can call. Are we concentrating on our breath? Are we giving importance to our breath? Whether our nostril breathing is proper. So all these concern. So according to pranayama, pranayama means there are 72,000. So if I say about pranayama, it will be a big thing, because one of the main thing about pranayama is according to pranayama, there are 72,000 plus nadis. Nadis is nothing but energy channel. So according to this medicinal system, it is really hard to accept those things. There are so many what we are believing is there are 72,000 energy channels in our body. So according to pranayama, with the help of pranayama, we are trying to purify these energy channels. The simple logic of pranayama is just correction of your breath. With the help of you are just meditating, okay, or just close your eyes and sit somewhere at a mindful place, or somewhere you can sit quietly. Just concentrate on your breath. No other disturbance. Just close your eyes and sit wherever you have. Make sure your head, neck, back is erect. Okay, how many of you are sitting like that? Your head, neck, back erect? None of us. So all of you are sitting like this. Yeah. How much ever we are able to comfort ourselves by sitting like that, we are ready to sit, right? Yeah, okay. So at least in a day, at least for 15 minutes, or okay, leave 15 minutes, I am not giving you such a hardcore. At least for 5 to 10 minutes, sit in a calm place, sit in wherever you are comfortable, your couch, your sofa, your floor, or wherever. Not on your bed, because it will directly lean back to the Shavasana pose. So I don't want you to sit on the bed. So you sit somewhere you are quiet and calm. Sit there, keep your head, neck, back erect. Close your eyes. If you want, you can play some calm music, or else I recommend close your eyes. Just keep your right palm on your abdomen and your left palm on your knees. Close your eyes and just concentrate on your breathing. Just concentrate on your breathing for 5 to 6 minutes, 5 to 10 minutes. Let us see what changes it is bringing for you when you start practicing it daily. So after that, what personally I can say, like what and all changes it can bring you in your life. I know everyone is having a hectic life, everybody is running, but are we giving a time for us, for ourselves, a me time? No me time. You can, I recommend you can do it in the morning. Early morning, like I always recommend before food. Okay, not in the night, because at the night what happens is, like we are having a schedule, like we are having a schedule. After a busy schedule, we just our body is totally tired. We just want to relax. That's the only thing which is going on in mind. So at that time your body is ready to relax. Your body is not ready to activate. Okay, so in the morning you will be getting a clarity about what you want, not for the day, what you want in your life, who you are, whether you are having a time for yourself. So these things you will be able to get at that time span. Okay, so try practicing at least these kind of small techniques. Try practicing some kind of yoga asanas, pranayama. You can now, there are like a range of these YouTube channels which is giving you so many advices, but make sure which is indicated for you, which is contraindicated for you, which is good for you, which is good for your body. So always go with a guided practice from a proper person or from a professional, I say.
And we had a lovely session with Dr. Harita as well. I have a question for all of y'all, since y'all are in healthcare. How many of y'all have a self-care ritual? Your own self-care ritual? Something that you do regularly, not daily also. I completely understand if it's not daily, but regularly. Any self-care ritual? Okay. You're talking more about skincare. Self-care. Okay, so somebody, we always think that somebody who's working in health or healthcare will be, very, very passionate about their own health as well. Because, of course, when you are not healthy, how will you, serve your patients well? But even though, exactly, even though that sentiment might be so common, it's very rare that you will find somebody, who's very much dedicated to their own health or healthcare, unless they've had a bad experience in their life or they've actually suffered with something very terrible. So I would want to take this moment here to remind all of y'all to at least inculcate one ritual, or it could be something very, very small. Maybe you sit in a quiet place for about 2 to 3 minutes, or you take a walk for 5 to 10 minutes after you finish your lunch or dinner. Something as small as that, but if you do it regularly, that is your own ritual. And once that is a part of your habit, you can take up something else. So the reason I brought this up is because, we do these experiences where we are setting an intention so to make you a little more mindful about your health. And that is what I am going to speak about. So mindfulness, this word during the lockdown, we must have heard it, at a million places. Like if you ask anybody today, what is mindfulness? What would be your answer? Mindfulness. It's something that gets thrown around on the internet quite a lot.
Being in the present?
Being in the present, yes.
Be conscious about what you're doing.
Be conscious about what you're doing. They're absolutely correct. So why am I asking you about mindfulness? So there are two forms of being. Either you are mindful, either you're not. Either sometimes you're mindful, sometimes you're not. So that's kind of like a gray area over there. But most of us who are really, really busy, and especially all of y'all you start your shift, and then by the time you're doing all your work, you see the clock. Okay, your shift is already over. So that's that mode of the day passing out so fast, or something that we call as autopilot, is something that you're supposed to try to avoid. Now, why is that? There are so many studies that are done today which show that why an autopilot could be a bad thing long term. You're not able to take care of yourself. You don't even realize how stress is affecting your body. You are making decisions based on previous patterns or whatever that's ingrained in your body. So on old habits that have been set a long time ago, possibly in a survival mode, possibly if you're working longer shift. So those patterns, you're still following those patterns to make newer decisions. Things must have changed, atmospheres must have changed. You might be in a different environment, but you're still taking decisions in the same old way. So just to avoid that habit, for your body to move out of that autopilot or that survival mode, you need to inculcate the habit of mindfulness. Now, when we say mindfulness, yes, it is being conscious about yourself or knowing what you're doing, but it also means that you have to. There are 3 aspects of mindfulness. 1, living in the present. 2, attachment, and 3 is detachment. Now I will quickly go through all of these. So 3 things you've written and rate them from 1 to 10. Say suppose driving is one of your things. So from 1 to 10, 1 being the least engaged and 10 being very engaged, very focused at what you were doing, just assign a particular number to that activity. Okay, so whatever that you have written 10, ideally it could be 2 things. It could be something that you really like doing, a hobby or activity or something that you really enjoy. Or it could be something that you've been doing for a very long time, like your profession, your job, coming to work, something that you're doing for a very long time. Now, it's very easy to understand that the second one of this is when you're going on autopilot, as in you're doing everything correctly, you're doing all of it, but it's more out of habit than out of having the liking for it, more out of how proficient you've become with it over the years. Driving is one example. When we are learning to drive, we are more engaged with the activity because we need to know the basics first. But once we are done with the understanding all of it, slowly over the years, you move it into autopilot because you already know it. Now you can not close your eyes, but you can drive efficiently without much effort, correct? So again, coming back to my point, why living mindfully is important. It's very good for your health. You are going to be making better decisions. Like I said, you're no longer in autopilot or in survival mode. Your circumstances might have changed. The environment that you're working in might have changed. So you make better decisions when you take a step back, assess first how the situation is, and then take a decision. You communicate with people better when you're mindful. Nobody likes a person who is, just doing all the things and not interacting with them, or it's very cold, it's very superficial. We usually like people who interact with us, connect with us, at a deeper level. So all of those things automatically come about when things inside us are, all right, or we are at a place where we feel all right, correct? Stress management. If you're more mindful about your body, you know when you tend to need a little more help, or when your health is kind of, not in a good place. Of course, y'all would know it better than anybody else, but being more mindful about it, something like that, we need to cultivate, and it doesn't come easily, but once it does, it stays with you for as long as you keep up the practice. So very simple ways about being mindful. Most common way would be meditation. Now, just now when you were meditating, or when the volunteers were meditating, the first thing somebody said is, I feel sleepy. So that shows that you've been in autopilot for a very long time. That's why the moment your body relaxed, the moment you were kind of at a safer place, your body was trying to shut down or, go to sleep. So that just shows that you're on an autopilot for a very long time. You need to take things a little bit slowly, okay? Second thing is breathing exercises. Anything where you're bringing your consciousness back and, thinking through what you're doing and taking a step, that's the part of the, attachment and the detachment part of it. So you are kind of attached to taking the right decision, but you have to be detached from the outcome. Okay, these are very big words that I'm using, but the most simple way to remember it is that you are not your feelings, you're not your emotions. They are an essence, they're not the essence of you, they're a part of you. So when you think of it this way, it's very easy to kind of detach from what you have to do, but still be present while you're doing it. Okay, thank you.